when we have all the stuff that we bring back. Oh. I thought you were a student.
They just let anyone in.
I know.
Once you bring your stuff back, right, so you're gonna need, obviously you're gonna have your setup, okay, but you're gonna need some gauze and you're gonna need, your, cotton tip applicators. They're all in these packages, so the outside of the package is not considered sterile, right? So you can use your bare hands to open it with an aseptic technique, so that way you don't contaminate the instruments, right? Do hand hygiene, put some gloves on, and then you're ready to go, okay? Same thing as with the patient bin, okay? So now that I have my patient here, I'm all set up.
Go ahead and open your book
I
to
usually
the
sit on this.
intraoral exam. You're gonna be,
Try not to fall.
do you have your book?
I do.
Okay. So, where's your book?
Oh, mine is out there as well.
All right, you wanna get it so you can follow along.
Would you hold that?
We'll start over here and we're gonna walk her through the intraoral exam. So you'll start in the beginning and then we'll just, everyone's gonna read one. So equal torture. And all the dyslexic students are like reading ahead to try to find their bar. And they're like, I know, 1, 2, 3, 4, 5, okay, I'm reading that one. And then you're like, it says buccal, and we're like, buckle, and you're like, dang it. It's fine.
Yeah, make sure you're getting all of it.
I mean, I'm just holding it.
Just kidding.
I'm just holding it.
Please put it on the Facebook.
Facebook.
Put it on the Facebook.
Put it on the Facebook. On the interwebs. Do you need anything?
Reagan's missing her book.
Okay, all right, so now that I have my patient seated, I'm going to, bring her back. Okay. And now we're gonna start on this side, so I'm gonna have you read the first step for me.
Okay. Explain intraoral exam procedure and rationale to patient.
Okay, hello, Ms. Sowers. My name is Mrs. Macaluso. I'm gonna be, doing an intraoral exam on you today. An intraoral exam is something that we normally do to check for any abnormalities, make sure that everything is okay in there. It is also part of our oral cancer screening. Are you okay with me proceeding with this procedure?
Can.
Okay.
Remove gloves and perform hand hygiene after your extraoral exam. Don new gloves.
Okay, you did that.
Provide patient with safety glasses. Place patient in supine position.
Okay.
Adjust dental unit light so the oral cavity is well illuminated.
Okay.
All right, under subgroup 1, lips and frenums, observe lips, noting any lesions, chafing, scarring, pigmentation, blisters, angular.
Colitis.
Yes.
Okay, palpate.
Okay.
Palpate upper and lower. Oh, you're gonna talk. I'm
Yep.
sorry. I'll stop.
Okay, so mainly I'm going to take a look and see if there's any abnormalities that I'm noting on the lips. Are they chapped? Are they blistered? Anything that may resemble like a red flag for oral cancer, okay? Or sun exposure. With angular colitis, you know, that is going to be found on the corners of the mouth. You're gonna see crusting there, okay? We're gonna go more into that in oral pathology too. I know we kind of briefly covered it last semester, but just anything that does not seem within normal limits, okay? All right.
Palpate upper and lower lips between thumb and index finger for masses.
Okay, so I'm going to palpate the upper lip, make sure there's no masses in here, okay? Okay, good.
Okay, so we're gonna place fingers in vestibular area and ask patient to close. Extend the upper and lower lip, move them side to side, up, down, observing the attachment.
So I'm gonna use these 2 fingers, right, just like we went over in class, okay? I'm gonna have my patient open for me, and then I'm going to have her bite down, and then what I wanna do is I wanna manipulate the tissue to see if there's any abnormalities. In particular, the frenum restrictions, okay? So up here, we noticed something earlier. So you see that little tag, skin tag there? Okay, what is that? Yeah, so she had a restricted maxillary labial frenum, and probably when she was a kid fell on her face and then gave herself a little frenectomy for free. So there's your evidence right there. Okay, next.
Subgroup 2, buccal mucosa. Ask patient to open and inspect the tissues of the buccal mucosa using a mouth mirror and proper lighting.
Okay, so now I'm gonna go in and I'm gonna take a quick look and see how the buccal mucosa looks. Okay, but one important thing that I did want to note that I should have mentioned before I started going in her mouth is never go in with your bare hands, okay, until you know what is in there. Okay, so usually before I start any of this, I go in and I just do a brief intraoral inspection. Okay, there's no herpetic lesion there. Okay, everything looks good. And then I have the patient open for me, because sometimes you'll see the herpetic lesions on the palate. Okay, so you want to just briefly inspect before you stick your hands in there. I already inspected her before, so that's my fault for not mentioning that again to you, but just go in with a mirror first and do a brief little inspection, okay? So now, we're gonna go in and we're going to inspect, to see if there's any linea alba on the cheeks, any bite marks, any trauma, okay? All right, what's next?
Did you? Oh, it's me. Okay. Dry and observe sense and stuck.
Okay, so we're going to get the, yeah, this one's dry. I'm gonna get a piece of gauze and I'm going to go ahead and dry the duct that's up here, right? So I'm going to get my cotton tip applicator, and now what I'm going to do is I'm gonna find that duct, and her duct is right here, okay? So now we're gonna milk the gland. Yes, okay, so what I'm going to do is I'm gonna start from the top of the duct and kind of roll this down. Roll it down a little bit. You see the saliva that just came out of there? Okay? And then we're gonna do the same thing on the other side. And now her duct is over here, so I'm going to start from here and I'm just gonna push it down. And there's some saliva that just came out. Okay, so if there's no saliva coming out, it may be a blocked duct. You may be dealing with maybe a salivary stone or something in there, but you should be able to feel that with your intranectaroral exam, okay? Or if the patient just has xerostomia due to medications and all of that, we're gonna cover that in class, okay? So that's how you inspect the ducts, okay? What else?
Palpate buccal mucosa digitally.
Okay, so I'm gonna start with the half, the midline, okay, on the top, 2 fingers in and my thumb out, and I'm just gonna go kind of in a circular motion, okay, just feeling the whole side of the cheek, okay, just all the way to the midline down here, okay, and now I'm gonna start the midline down here with my thumb inside and inspect. Remember what we were feeling for last semester? Okay, any of those, the lactic acid buildup or any of that stuff, that is what you're gonna be looking for. Okay, or any cysts and, you know, stones and stuff like that, okay? I did feel something here, okay, and it's on both sides of the mouth, okay? So, I'm gonna just have you open. So right here, there's an indurated lesion, okay? So you see it looks a little raised, okay? That's the beginning of a fibroma, okay? She's biting the corners of her mouth with her teeth. We have the same thing over here. So you can see that it's a little more pronounced here, okay? It's a little more pronounced there, right here. And you can actually feel the bump, okay? Some patients have them really, really big, where it looks like a giant circle that's coming out of their mouth. Sometimes they have to be surgically removed, okay? We'll talk more about that again in class. But just looking for any of these type of abnormalities, okay? All right, what's next?
Identify any white patchy areas, lesions, or indurations. Identify Fordyce
granules?
Fordyce granules, linea alba, pigmentation, or other abnormalities.
Okay, so again, you're looking for any type of abnormality, so we're gonna go more into oral cancer. You're gonna see that obviously if she had like a giant brown area or a dark, you know, really, really dark area, that would be, you know, a little bit of concern, so, when in doubt, if you're not sure of a lesion, just get one of your faculty, will come in and double check, and sometimes we'll even get the dentist. But you also have the oral ID that we went over last semester, okay, so that'll help, to bring any of those abnormal cells up to the surface, right? So with her, I do see some fordyce granules in here. They're not as prominent, but they're right here on the corner of her mouth. You see those little dots? You see those little dots? That's what fordyce granules look like. Okay, some patients have them more on the cheek. Okay, she has them a little bit on the corner of her mouth. Okay. So, see, they're like little tiny yellow sebaceous glands. Okay. I don't see any on this side. But some people have them on the whole side of the cheek, on the inside of the cheek. Okay. So like you see those little dots? Okay, those are your fordyce. All right, what's next?
Subgroup 3, the tongue. Ask patient to extend tongue and takes moist gauze to grasp tip of tongue for easy inspection.
Okay, so we wanna be nice to our patients. We don't wanna just grab the gauze and stick it in their tongue, because then they're gonna feel like they have hair on their tongue. So usually you wet a piece of gauze, so I fold it this way, so I have enough surface area to grasp the tongue with, and I have them stick their tongue out all the way. And then I kind of wrap the gauze around it, and I get my finger, and I'm going to kind of flip the tongue over to the side, and I want to see all the way back there. Some patients, you need to use the mirror, okay, to be able to see all the way back there with that indirect illumination, okay? And then I'm going to do the same thing on the other side, okay? Because that's usually where oral cancer hides, is all the way in the base of the tongue. Okay, so we're inspecting the base of the tongue. Okay, what else do we have to do with the tongue?
Okay, inspect the lateral borders and base on each side. Inspect the dorsal surface, noting color and texture, and then inspect the ventral surface.
Okay, so now the dorsal surface, her tongue is nice and clean. Yay, hygienist. You know? But you see, she has a little bit of a scalloped tongue here. Okay, so because her arch is a little narrow, right? So she's biting a little bit of the tongue. So I'm going to inspect the lateral border here. You see she has a little bit of a linea alba starting on the lateral border of the tongue. Not very prominent, okay? But some patients have it more prominent. See over here, you can see a little bit, okay? You see that? Okay. And you're also going to inspect the ventral side of the tongue. So we're gonna have her lift her tongue up to the roof of the mouth. I'm gonna use this mirror, because you see these folds of tissue down here? Sometimes it's hard to see. So you want to pull the fold of tissue out of the way so you can actually see underneath there, see if there's anything that needs to be noted. Okay, all the way under there. Okay. You're also going to check for any varicosities. Okay, that would be located here. Okay, what else is on the list?
Palpate the tongue by digitally.
Okay, so I'm gonna have her stick her tongue out, and I'm going to start here. Her tongue is a little restricted, so it's a little difficult to do. So one finger underneath, one finger on top, and I start over here, and I just come and glide it forward to see if there's any bumps or lumps or anything in there. Okay, what's next?
Identify enlargements, lesions, or other abnormalities.
Okay.
And then subgroup 4, floor of the mouth. Inspects
Okay.
floor of the mouth using a mirror and proper lighting.
Okay, and that's what we did. Okay, what else?
Compresses salivary glands and checks flow through Wharton's duct.
Okay, so now we're going to do the same thing down here on the floor of the mouth. So if you remember, this is the sublingual carbuncle, right? You see that little gland down there, that little duct, okay? So we're going to also milk this duct. We're going to kind of see if there's any salivary flow coming out of there. So you see right in there, there's a little saliva coming out. Okay, so you want to take a look and see if there's saliva coming out, okay? Sometimes you can also do this, but don't, don't quote me on this. Look. That's how we know if there is xerostomia, that'll stay stuck and it's not sticking, look. See, it's not really sticking. See, it's coming down? Okay. All right, what's next?
You got palpates the floor of the mouth by manually with index finger of one hand inside the mouth and the middle and ring fingers of the other hand outside and under the floor of the mouth.
Okay, so my middle finger is my longest one, so I'm gonna stick this one, I'm gonna start here. And I'm just going to kind of go back and forth. You see the motion that I'm using? Okay, just to see if there are any abnormalities, but you have to make sure you're really palpating in there. Go all the way to the back, okay? All right?
Okay, identifies any enlargements, lesions, or abnormalities. Do you just want me to read the next?
No, we're still on the tongue, right? Or
That was the floor of the mouth.
Floor of the mouth.
the floor of the mouth, okay.
Yeah.
So, I do wanna point one thing out, okay, so this is an abnormality. So this is, she's got a restricted lingual frenum, right? So you see how the tongue, when she lifts it up, you see how it makes like a little heart on the tip? And how it kind of turns this way, cause it's restricted. Okay, so it's restricted, it's not restricted to the apex of the tongue, but it's restricted more, a little higher than the middle portion of the tongue on the ventral side. So that's a moderate restriction, okay? All right, so if they have any restrictions, you'll be able to see it when you have them open their mouth and try to lift their tongue up without closing their mouth. You'll see that little heart shape, okay? All right,